So I can't work out if this gaggle of people here are coming or going, but please come. Come and join our wonderful session. Okay, great. I'm going to start the session. Yeah, hopefully everyone can hear me okay. This session is on bridging air pollution, health and climate and tackling black carbon and ultrafine particles. I'm Rachel Huxley. I'm the head of mitigation at the Climate and Health Research Program at Wellcome Trust. And it's an absolute pleasure to moderate such an important session. We know that black carbon and ultrafine particles have a significant impact on health and on climate risks. And the aim of this session is to review the latest evidence on both black carbon and ultrafine particles, and also to review that evidence on exposure and health effects, and also to highlight actionable mitigation strategies and encourage collaboration across sectors. So we're going to be demonstrating and discussing how integrated approaches can achieve measurable health benefits whilst driving progress on air quality and climate action. So looking for that triple win. The session's going to start with 3 presentations to overview the evidence, after which we'll have time for questions from the audience. So please, while you're listening to these first presentations, be thinking about the questions that you'd like to ask our experts. We're then going to have a science and policy panel, and the folks on the panel are going to share their experiences and their insights of taking action on the ground. So again, a great opportunity to hear from what's already happening to tackle this problem. So to start with, I'd like to invite Lydia Morawska to come and give an overview of the exposure and health effects of our ultrafine particles. Lydia is Distinguished Professor and Australian Laureate Fellow at the School of Earth and Atmospheric Sciences at Queensland University of Technology.
Thank you very much, Rachel. Welcome everyone after lunch. It's really great to be here. Ultrafine particles. The key words in my presentation is exposure and health effects. But we'll first start with making sure that we all understand what ultrafine particles are, with kind of boring thing, which is definition, nano and ultrafine particles, particle number concentrations. There are definitions in the ISO standards about nanoparticles and very similar about ultrafine particles, basically particles below 100 nanometers. Just different terminology used in different fields in atmospheric sciences, ultrafine particles. Now, one problem with this is that since we measure particles in terms of number concentration, not mass concentration, because mass of the particles is very small, so it wouldn't make sense. Measuring size distribution number creates certain problems and complexity. I'm not going to go into details of this because we don't have time for this, but in the current WHO guidelines, we have a slightly modified definition, which is quasi-ultrafine particles, which is particles going down at least down to 10 nanometers and no restriction on the upper limit. The reason for this was because this supports exposure studies and makes it easy. We can talk about the details of this later. So basically we're talking about quasi-ultrafine particles. Exposure to ultrafine particles. Do we know how much we understand this? We know very well that particles in urban air, in terms of particle number, are predominantly in that ultrafine size, originating mainly from traffic or other modes of transport. There are some size distribution here of CNG, diesel, and petrol. Now, but they're also generated through secondary processes, formation of these particles in the air. So this banana curves, these particles form as very small and then grow. The significance also is to mention that with time and with transition to clean energies, we'll have fewer primary particles, but we'll have more secondary particles, and what the impact of this will be is quite important. So we understand those things. We also have a reasonably good understanding of source contribution to particle number concentrations for the places where such measurements were conducted. This is Phil Hopkins studies from the US, which reviewed these concentrations and contributions around the world. So, as I said, we have a reasonable understanding of this. Now, particle concentrations in different environments. This was a study which I led quite some time ago, comparing concentrations in different environments from heavy traffic down to clean environments. Mind you that this is a logarithmic vertical scale. But basically what we could conclude based on this is that in clean environments, particle number concentration is less than 10 to the third, urban background less than 10 to the fourth, near roads above could be higher than this. So this was the first study like this, comparing situations around the world, and then the second was a little bit later, and here the comparison was between background and or sort of urban sites and traffic sites, where we found quite a lot of similarities between the concentrations in such environments. Again, I'm not going to talk about the details of this because that's not possible with time, but this understanding of the concentrations made it possible in the current WHO guidelines to define typical particle number concentrations. So typical daily 24 hours mean concentrations in clean environments below 10 to the third, in urban background between 10 to the fourth, and in typical hourly mean in clean urban environments below 2 by 10 to the fourth. Now, what's the significance of this typical? They are not recommendations, they are not guidelines, but these typical values enable comparisons and to distinguish between low and high particle number concentrations. So, as I said, we have this understanding, and I'd say it's quite solid understanding. There are also other ways at looking at particle characteristics, never in mass really, but in particle surface area, and toxicologists would say surface area would be a better measure because that's the direct contact with the lining of the lung. But this is far more difficult, but studies like this have been done, and we have some understanding about this. So what are ultrafine particle health effects? Just examples of some studies. One, uptake ultrafine particles and traffic emissions conducted in Brisbane, 25 schools, showed that the ultrafine particles do not have respiratory health impacts, but have systemic effects, which was quite understandable because it is not really the particle deposition in the lung, but particle penetration through the epithelium to the blood system. So that was one element of evidence. There was a study conducted in Barcelona by this team from Barcelona, and here the investigations was about particle concentrations in 3 cities, in Barcelona, Huelva, and Tenerife. And the team looked at the concentrations, total concentration, particle number concentration, and N1 primary, which means mainly related to black carbon, and secondary with low break carbon. While they noticed, or they showed that the mean concentrations were similar in 3 cities, but black carbon high in Barcelona and Tenerife. but the point was that associations with daily mortality in Barcelona and Tenerife were with N1, which is with primary black carbon particles, in Huelva with N2. Now this may sound, well, is it important? It is important because that issue, primary versus secondary, and particular in the changing world, do secondary particles have the same impact as primary particles? Another studies, an example of studies, association of annual average ultrafine particle exposure and natural case and case-specific mortality. That was this study presented here, and I'm not going to talk about the details of this. Now, but these are examples of the specific studies, but one issue here is, can we, base on these studies, can we come up with exposure response curves? And this is the biggest issue. Ultrafine particles exposure response relationship, and the point is that until we have exposure response relationship for ultrafine particles, we cannot have guidelines that as simple as this. So coming back now to WHO air quality guidelines, this was a statement, that first statement was, while there is considerable toxicological evidence of potential detrimental effects of ultrafine particles on human health, the existing body of epidemiological evidence is insufficient to conclude on exposure-response relation. This was 2005. And I'm proud that I was asked this, I wrote this, but this was the only what we were able to include then. Well, within the time span since then, there was the conference, important conference on workplace and indoor aerosol. I didn't touch anything. A conference in Casino, the same conference which will happen at the beginning of May. We concluded we know so much about ultrafine particles scientifically, we have to do something about this. Really, we have to use this information. So this is in the middle of the photo. So this red poppies, that's are poppies from Monte Cassino, where we decided to do something about this. Then we were very pleased to be, again, I'm not touching anything, whatever is happening on the screen. We formed the team, thinking out of the box team, and this is a photo of this team meeting in Munich. I think Annette is here, who hosted us for this meeting. We came up with this document, white paper, which then became a WHO good practice, is in the document, and I was very pleased to learn last year that elements of this are incorporated now in the EU recommendations. So the challenge of the particle monitoring is how to scale up ultrafine particle monitoring, since the existing instrumentation is far too complex, often insufficiently robust, require expert, not feasible for large scale. And this is an ongoing problem with achieving enough evidence for exposure response curves. So new approaches to ultrafine particle monitoring, and that's what good practice recommends, using emerging science and technologies to progress this area of science, and in particular focus on primary versus secondary particles. And as the last point I'd like to make here is that this is what we are doing, and this is now a large international team of about 20 sites. We've presented this project, which we agreed will use much simplified instrument, having just 8 channels, not the whole range of 160 channels, but enough for the purpose of distinguishing primary versus secondary. 20 sites around the world and growing, 1 year of monitoring to demonstrate that this information is of sufficient quality for exposure response curve, and the instrument is sufficiently robust. This was presented at the European Aerosol Conference last year in Finland, and this progress will be presented next in May at the conference in Italy. So we are hoping that the successful completion of the study, and it will be successful, we already have data, it's going, this will be a step forward towards future prospective exposure response studies, and focusing on one new element, which is on the impact on the brain. There's more evidence that it's not just penetration through the respiratory system, but directly through the olfactory system to the brain, which is extremely important. Thank you very much.
Thank you so much, Lily. That was an incredible run through and an overview of the science, and sobering to end with how it's all impacting on our brains. It's a pleasure now to introduce Zorana Anderson, who's going to give an overview of the exposure and health effects of black carbon. Zorana is professor in the Department of Public Health in the Environment Health section at the University of Copenhagen.
Thank you very much for inviting me to speak here. So I will continue in line with Lydia's talk and see where are we with black carbon with exposure response functions. I guess this is the topic of the both speeches. So just quickly on the black carbon and the background, this is a powerful air pollutant that is, which particles are part of PM2.5 and particles that are formed by incomplete combustion of biomass and fossil fuels. The sources vary around the globe, corresponding to what are the major sources of black carbon, from indoor cooking and using a coal of wood for cooking inside or heating, as in Eastern Europe, to diesel-driven vehicles for traffic and non-traffic, more in the Western, richer part of the world, to agricultural burning and production of energy, coal plants, and so on. Apart from being dangerous air pollutant, black carbon also absorbs energy when the particles in the air, since it's black, and transfers it to heat, so it's a forceful climate change promoter and contributes to to global heating. So just quickly to show some of the recent or less recent synthesis of evidence of black carbon, we have to mention the WHO Health Effects of Black Carbon report for 2012, quite old, which summarized the evidence that back then about 40 studies on short and long term of black carbon, concluding that there was sufficient evidence actually on effects on mortality and some morbidity outcomes for short-term effects, but still ended to conclude that the WHO recommends to continue using PM2.5 as the primary metric in both quantified exposure and health effects. So we're still not there to recommend regulation of black carbon, not having that right exposure response function. EPA did, that went too fast. The EPA did their own synthesis of evidence in a very similar manner, concluded in 2019, that there are many components and evidence of health effects of different components, but we're not there to recommend regulation of black carbon, but rather focus still on PM2.5 mass. And as Lydia mentioned, for black carbon, as for ultrafine particles, there we don't have the right response, exposure response function. So this is just a good practice statement that recommends still, there's no guideline, not enough evidence to set the guidelines, but recommendation for measurements and so on. So that's where we are. So today I'll focus mainly on long-term effects of air pollution. This is very non-systematic, and we'll hear more systematic approach after me. But just to see where we are now with black carbon health effects. So I'll just focus on this recent meta-analysis on all cause-specific mortality and black carbon, short and long-term effects, and I'll just focus on long-term. And here we see actually quite a considerable number of studies, around 13 studies on long-term exposure, and that works. That show clearly significant associations with black carbon. That is also seen with cardiovascular mortality, ischemic heart disease mortality, and even stronger association with respiratory mortality, and especially strong with lung cancer mortality, which is, I guess, in line with mechanistic understanding of black carbon being carcinogenic, but also inflammatory, as we see with PM2.5. There were 3 new studies published after this meta-analysis, which I wanted to point out. They all find significant effects with mortality, and I summarize them here. So this is the table we tried to make with students from my group to point out to this key issue in effects of black carbon, where it's independent of that with PM2.5, and number of studies do not actually show two pollutant estimates, but here are the studies. About half of those 13 studies, but less, and then 3 new studies show estimates of black carbon with all-cause mortality here, and those estimates adjusted for PM2.5. And short, and sorry, my bolding is a little bit confusing, but pretty much we see consistent estimates, whether they are a little bit attenuated or remain the same. We see from these studies that black carbon health effects seem to be independent of those of PM2.5. They show something different and additional. Apart from mortality, which was the focus of earlier evidence synthesis, we have also quite a lot of new morbidity studies, and I guess I'll just focus non-systematically on a few of them. This is a nice review on pregnancy and maternal and fetal health, and just to show it out, I summarize how many studies have looked at different outcomes in child and mother. There are most studies on low birth weight, and most of them show effects, as we see with PM2.5. There are also 2 new studies after this review published mentioned here, and we see with most relevant childhood outcomes that they have been studied, and they all find plus indicates significant associations. And similar with mother, we also see effect with effects in mother, such as gestational diabetes, preeclampsia, and so on. Again, in line with what we see with PM2.5. I'll point out to one well-conducted autism study in black carbon, and that one also finds effect with black carbon as well as PM2.5. That's among children outcomes. And then I point out to some studies that have good black carbon data. So I point out a few studies from American multi-ethnic study of atherosclerosis and air pollution MESA, which is a good study on long-term effects of air pollution and cardiorespiratory biomarkers. And they find in 2 of the studies significant associations with lung function and pulmonary vascular volume, these biomarkers of chronic respiratory disease, but none with coronary heart disease in the study where they find effects with PM2.5, but not with black carbon. So effects seem to be a little bit more consistent perhaps with respiratory diseases, but this is still early findings, I guess. We have looked at COPD and asthma since we have been conducting meta-analysis, and my student have summarized this 5 studies on COPD and black carbon, and again showed that all of them show significant effects. Only one showed results adjusted for PM2.5 and found completely same estimates after adjustment. And he even meta-analyzed this, and we find clearly strong associations with black carbon and COPD incidence from all of these studies clearly all show detrimental effects. For adult onset asthma, there are only 2 studies, and again, the one that shows association. This is a LAPS project study with several cohorts that show consistent results after adjustment for PM2.5. And then finally, I wanted to point out to a LAPS study. This is a big European study with a number of different European cohorts. And this is with a good data on black carbon, so I thought this is a nice comparison of some results before and after adjustment of black carbon across different diseases. Again, in this quick overview, I showed that this study detected effects of black carbon with asthma, COPD, stroke, weaker with ischemic heart disease and black carbon, in line with PM2.5. We had strong results for PM2.5 for lung cancer, but important point here is after adjustment for PM2.5, the results remained unchanged. So this is a little run through. So just to conclude, that since the recent evidence synthesis from WHO and Environmental Protection Agency in US, we see significant number of new studies. They all seem to point out to significant effects of black carbon, and they seem to be independent from PM2.5. Morbidity studies show the same. There's fewer studies. We need more evidence, and we call also for presentation of 2 pollutant models, which will be important for future evidence synthesis. And we also need more studies on other newer morbidity outcomes for brain diseases and all the others. with this, I will just like to conclude that there seems to be solid evidence pointed towards soon enough evidence for those correct exposure response functions for regulation. And of course, just to remind that black carbon is also, there's a sound climatic reasons for stronger regulation and regulation of black carbon, since it's such a strong climate change enforcer. And with this, I'll end. I hope that was within 10 minutes. Thank you.
Thank you so much, Sorana. It's really useful to see the recent evidence that's been coming out as well. So finally, I'm just going to introduce Pablo Orellano. Pablo is going to provide an update on the WHO's ongoing systematic review. As you just heard, the last one was undertaken in 2012, so another one is being undertaken now. And Pablo is a researcher at the Consejo Nacional de Investigaciones Científicas y Técnicas. So Pablo, the floor is yours.
Well, very briefly, I have been working for WHO as a consultant for the last 7 years with 6 systematic reviews already published for the air quality guidelines, the RAPI2 and the IMAPEC projects. I will be the lead systematic reviewer for this new review, which will start in about 6 days, I think. The review question is, in the general population, what is the effect of an increase in short and long-term exposure to black carbon on the risk of all cause and cause-specific morbidity and mortality as reported in cohort, case crossover, and time series studies. This review question follows the format of the PICOS question, population exposure, comparator, outcome, and study design. There are 2 aspects to this relationship between black carbon and human disease. The first is the causal relationship. We will not focus on this because this is well established. We will focus on the second aspect, which is the numerical association value, the relative risk between a fixed increase in black carbon and an increase in the risk of morbidity and mortality. The first part of this, the systematic review will be the systematic search of original articles using international databases, for example, mainly Medline via PubMed, but also potentially including others like Embase, Scopus, and maybe others, and regional databases, for example, LILACS for Latin America, African Index Medicus, and other regional databases, all included in the Global Index Medicus. The second part is the risk of bias in individual studies and certainty of the evidence assessments. We will use 2 tools specifically designed for air pollution studies developed by WHO experts in the context of the update of the Global Air Quality Guidelines in 2021. These 2 tools were also used in for the IMAPEC and RAPI2 projects. As in any systematic review and meta-analysis, we will use a battery of statistical tests and graphical representations, including random effect models and forest plots for meta-analysis, I-square values and 80% prediction intervals for heterogeneity measurement, subgroup and sensitivity analysis to try to explain part of this heterogeneity, and Eger test and funnel plots for publication bias assessment. Sorana already talked about the first one of these studies. The second one was recently published in 2022 in a scientific journal. Included 70 studies and found significant association between short and long-term exposure to black carbon and cardiovascular diseases, but also found inconsistent evidence of the association between respiratory diseases and black carbon. The author concluded that further investigations are required, and this is where this new study will come into play. Okay, thank you.
Oh, okay. Yeah, sit down here. Oh, no, I've got to speak at this and try and get us a mic. Hi, have we got microphones? Can we get a handheld mic? Perfect. And can we get a couple? Because we'll need some for the audience who hopefully have a barrage of questions for us. Can I see any hands for... Okay, fantastic. Keep your hands... Okay, Okay. Are you going to...
Thank you for the lovely presentation. So it's Mark Miller from the University of Edinburgh. I'm wondering what your thoughts are. A lot of the toxicological evidence for black carbon shows that it's active, it generates free radicals, but actually it's not as reactive as some other forms of urban PM2.5 or things like diesel exhaust particles. So to what extent do you think is actually the black carbon having the health effects, or the black carbon's just a surrogate for something else that's in PM2.5?
Well, I answer it very epidemiological way that we cannot really get answer to the question from epi studies like this, especially the ones that don't distinguish in two pollutant models. So, yeah, I also wanted to include the correlation coefficient for all these studies between the two. I thought that would be more than 10 minutes. So maybe you can give us that answer better from toxicological insights than we can do from epidemiology right now.
Thank you. I think we got, we had a lady just behind with a question over there, and then we got, I don't know how we're going to do this. Perhaps we'll take a few questions at a time. So let's take this, this lady here, please.
Okay, my name is Annette Peters from Munich, and many thanks for providing this overview. And it's really a striking difference for the black carbon compared to the ultrafines as presented. And I was wondering, I mean, Lydia, you pointed out that indeed the particles are hard to measure, and that we have also evidence that they're differently distributed. What do you have, I mean, how, and our studies in the past have also shown that in short-term studies, they seem to be reacting much longer. So we find like responses and a week later on mortality, for example. So do you have, where do we look to really pinpoint this down? Because we have been searching or trying to substantiate this evidence for now decades.
Well, in my view, the key here is more measurements, because the measurements so far were very small in number, very difficult to conduct using the instrumentation like SMPSs and so on, with lots of data losses. So unless we have much more measurements, it'd be very difficult to progress. And that's why we are saying now, in a pragmatic way, we can use CPCs, instrumentation which measure total particle concentration, as long as they go down to 10 nanometers. But this instrument which I showed, which is Partector 2, it is its predecessors, Disk Mini, Nanotracer, they worked perfectly. Now, because this one has 8 channels, so it will pragmatically allow us to distinguish between secondary and primary particles. And this is a type of an instrument which can be placed in any monitoring station. It doesn't require any expertise. So this way, I would be arguing that basically every city or every suburb in monitoring station should have one of these instruments, and to collect the same level of data we are collecting for PM2.5. That's really where we should go with this.
I think there was 3. If we can have 1, 2, 3 here, that would be great.
Thank you. Alberto Ayala from the state of California. We have followed the issue of ultrafine particles very closely for many many years. And my question for you, Lydia, because you showed it. We published in 2002 one of the first reports where we actually identify ultrafine particles from compressed natural gas engines. David Kittleson at the University of Minnesota has also reported nanoparticles from gasoline engines, or petrol, like you call them in Europe. So the point is, we know that pretty much any internal combustion engine is going to give you an ultrafine particle signature. Now, from your perspective in terms of the exposure, are we ready to tackle making sure that we understand whether a nanoparticle from one is the same as the other, or whether there are some differences depending on the fuel and the emission control technology?
Well, I guess this is a different question, because if we do the measurements on the sort of level of the urban monitoring station, we are not getting signatures of individual sources. Now, if we were able to use instruments like SMPSs, we then see the individual, so we can clearly distinguish between diesel and petrol, for example, not as much as CNG, because it's a bit lower. But with the instruments which we propose to use, we will not be able to have signatures of individual of these sources. To add to this, this is not only the traffic on the road. This is bushfires. This is all kinds of other things. So, if we are to get signatures and the impact of these individuals, I'd say that will not be possible. Is this important? I think we've talked during this conference a lot about that the perfect is the enemy of the of better. So I'd say it's not important. The most important is, since many of the particles, really, we are talking about systemic effects, which is penetration to the blood system. So I don't think this is really a key of distinguishing between individual sources, but have enough information about the particle number concentration in this sort of broad channels, primary versus secondary.
My name is Karel Illy. I'm a pediatrician and also CEO of the Dutch Lung Foundation. I have a question to Zorana, because you were talking about the health effects of black carbon. And very, very briefly, you had a slide regarding autism, but it was too brief to see it. And actually, as a pediatrician, I was, well, at least puzzled and not immediately convinced that there is a relationship between these two circumstances.
On black carbon and autism slide?
Yeah.
Yeah. Oh, well, this is one study, so I wouldn't say this is proving causality between black carbon and autism. Of course, we need to see more. However, for PM2.5 and autism, that has been confirmed in recent IMAPAC study. There is sufficient evidence to suggest this is a causal relationship. And this comes from effects of particles on early childhood cognitive development and mental health early on. So I think also mechanisms are supporting this association. So we clearly see it with PM. And in line with that, I would believe in this black carbon result. But of course, we need more studies. This is one, maybe there's a few more. Does that answer your question? But I think impacts on brain, we also heard it in NCD session. Particles impacts on brain from early childhood development and cognitive development. We've just published a study in Denmark on school grades and air pollution, even at low levels. And so I think we're seeing more convincing evidence across the lifetime. And of course, effects on dementia now are really confirmed. There's a number of good systematic reviews coming out. So I'm prone to disagree, and I believe this result. But let's see a few more studies.
I'm really sorry. I know we've got more questions, but we've just been shown the red card in terms of time. And there's a panel to happen after this. So I would love to allow the questions, but in respect of the people who have come for the panel, let's give a huge round of applause for our speakers. Okay, so my only job for the panel is to hand you over to your marvelous panel chair, Martina Otto. Martina is head of the Climate and Clean Air Coalition at the United Nations Environment Programme. Martina, over to you.
Fantastic, thank you. Thanks very much, Rachel. And I have the pleasure to moderate this panel, Science Policy Roundtable, to look at integrating actions on air quality, climate, and health. And the roundtable is really meant to explore the key aspects and country experiences from mitigating black carbon and to highlight the benefits for both health and climate. And we heard how important the black carbon topic is and that it's not as simple either. The CCAC made the black carbon part of the whole package of the super pollutants as early as in 2012. You've seen some of the slides that we put out in this very first study that set us off. And I just want to highlight that while we discuss here, okay, on the health side, so what are actually the impacts? There has been a lot of back and forth as well on the climate side with an IPCC report that came out and saying, well, maybe it's not as giving us as many benefits if we address it. But the thought to hold here is that regionally it's extremely important. It's hyper important. And I'm particularly talking about the cryosphere. So not only the poles, but also obviously the Andes and the Himalayas and so on. So it's really important to keep that in mind. It has an enormous impact on rainfall patterns. So it really interacts in multiple ways, and that's why it's so important. The IPCC is now working on this short-lived climate forces methodology, and we're very, very pleased that we were able to really push for this PM 2.5 inclusion as well. So we'll see how that will unfold, but I think there will be even more crossover between the groups. And while it's important to unpack, and we've started doing that with a separate report on methane, it's important to unpack, to highlight the importance of black carbon. But if we talk about implementation, I really want to hold the thought as well that we keep things together, because if we look at the fossil fuel sector, for example, we had a fantastic speaker at the opening plenary telling us the story with the flaring, venting and flaring, for example, and the climate community looks at that from a methane perspective, very much so. But then obviously there's all the black carbon and the other co-emitted toxic elements that we need to look at. And the measure behind it is actually to prevent and to reduce the venting and flaring. And so from a sector perspective, it's good to keep things together, because then we talk about these double dividends. The same goes for waste management. And obviously we can start banning the open burning of waste. But in the end, what it is about is managing waste. And then we talk about reducing the methane, and we talk about reducing, for example, black carbon. And I just wanted to keep that in mind. Now, we have a fantastic panel, and I would like to ask our panelists to join me up here while I continue talking. Could you just come up, please? So we'll first have short interventions from our panelists. Some of them will be using slides, so we'll manage that, and then we'll move to a bit of a discussion. And first will come, so please take your seats. First will come Elisa Puzzolo. She's a policy manager on super pollutants at the Clean Air Fund, and she will introduce to us a new report by CAF that makes a strong case for taking climate and clean air together, the actions for better health outcomes. And I'll hand over to you, and I understand you do have slides and will come to the lectern. Thanks.
It's great to meet you all. I only have a couple of slides, so you can see the report. But let me just start by saying how important is this topic, really how taking accelerated actions on black carbon, both for climate and health benefits. It's crucial. And this flagship report was launched last week in Paris at the first ever World Glaciers Days. As Martina said, the impacts of black carbon on a regional scale, particularly in areas of snow and ice, the cryosphere, are fundamental, because black carbon is increasing its deposition, is leading to ice and glaciers melt that increase also the sea levels. In this report, titled Tackling Black Carbon, How to Unlock Fast Climate and Cleaner Benefits, we are really looking at solutions that are scalable, that are technically feasible, and also politically feasible. This report was developed jointly by a consortium of experts and also interviews with over 80 experts. And it was the advocacy team, it was the C-STEPS in India, as well as colleagues from Orbis-Air and Berkeley Air. So Michael Johnson here is one of the co-authors of the report. And this report outlines some of the solutions. And on the next slide, I think this is really the key message that I wanted to describe today. There are three core main areas that all policymakers at all levels should be prioritizing. The first area is in relation to cutting emission reductions in the most vulnerable regions, the cryospheres and the regions in West Africa and South Asia, where also rainfall impacts are occurring. And particularly in regards to the cryosphere, it's really linked to these protections of snow and ice. Also, black carbon is linked to extreme heat events, so there's multiple benefits of taking actions for black carbon. Number two, prioritizing black carbon in cleaner and energy policies. By focusing on the black carbon-rich sectors and sources, we'll deliver the greatest climate benefits, as well as delivering the health and also economic benefits, in addition to social justice, because a lot of the sources are linked to energy transition and are linked to emission standards. So this, I would say, probably is one of the most important categorization that applies globally to every country. And then number two, what Martina was talking about, taking a coordinated, integrated approach across multiple pollutants into both national and subnational climate and air pollution plans. And these would include, for example, addressing the waste management sector with integrated solutions for benefit and reductions of both black carbon and methane, as well as adopting sustainable agricultural practices, for example, and that will also bring benefits in reductions of N2Os. So I would just conclude by showing you the QR code of the report. And I think this is going to be a resource that will be very valuable to people that have a lot of experience in black carbon, but also people that perhaps want to learn more about these important topics for both health and climate benefits. Thank you.
Fantastic. Thank you very much, Elisa. And we are playing a bit of musical chairs up here. Let me now turn to Professor Xu, professor at the College of Environmental Sciences and Engineering at Peking University. You've just, we have to actually really say kudos to what has been achieved in Beijing in only a short time, if you look at air pollution and addressing that. And your work is on monitoring and then tracking, and you will talk to us about the emissions inventories that are a tool actually to manage all this. So I would like to ask you up here, or if you like to, as you like. I think you don't have slides, but if you could tell us a bit more about your work and how data-driven insights inform and strengthen policies. Please.
Thank you. I do have two slides to present. Well, we know that as we're talking about the black carbon, it's all came from the incomplete combustion from carbon-containing fuels. Now we use hydrogen, then we don't worry about this one, but or whatever we use to burn, like produce carbon. And there's a major source for black carbon, like in China, we have more than, in the past, about 60 to 70% are using coal burning for the power plants. And then it generates a huge amount of black carbon. Then we have the vehicle traffic transportation, like a diesel, and it's also a major source for black carbon. Actually, one single source that has the most important health impact is the domestic use of the solar fuel, the coal, and the biomass burning, and which used to be one of the biggest emission part in China. So there's quite a complicated source, and I can add in more and more into that one to measure and to follow and to ensure that our policy controlling emission is in the place for the important source, as takes a lot of effort. Scientists have done a lot of tremendous job to marry the emission factors in order to estimate the amount of the black carbon emitted from different sectors. And now globally, we'll be able to build up emission inventory like this one to know which major industry, which sector, and which region actually has a huge amount or certain amount of the black carbon emission. And more importantly, throughout the years, we can see how successful or how unsuccessful we'll be able to control the black carbon emission. So these two slides, the second slide, I'm showing the trends. And you can see from the left one, what we call that the black carbon emission in China from the 1990 to 2020. And we see clearly a drastic reduction of black carbon in China. And from almost all the sectors. And the one important thing is, beside the power plants, beside the industry, and I believe it's 2016, we found that the household use for the coal and the biomass burning is a major source for the PM2.5 in Beijing in the wintertime. So we proposed the idea to control or even reduce the coal use for the household heating. And the government took our message and take the action, and that's one of the major reasons we see the drastic reduction in the black carbon emission. So, but if we compare to the global emission, and there's also different regions, including the Europe, North America, and China, and Asia. You see the trend in the last 5 to 10 years, reduction in black carbon is mostly came from Europe, North America, and China. And the rest part of the world will see increasing emission. So that means that efforts need to be paid attention to the whole world to reduce black carbon emission, and hopefully that could be bring the health benefit from that. Okay, I stop here. Thank you.
Thank you very much. That was fantastic, and showing us how the measurements actually help us to take the right policy measures as well, identify a key sector. And I mean, now we go from the coal and biomass burning to household energy. And I would like to turn to Michael Johnson. He's the technical director at Berkeley Air Monitoring Group. And obviously, I mean, here as well, I have to say, California, we've always been looking at California if it comes to air quality and the standards that have been set that then become the national. And obviously the amazing work that has been done by the group as well. So you will talk to us about how we can move the needle on household energy, how the clean household energy transition has been playing a role to reduce black carbon and short-lived climate pollutants.
Yeah, thank you so much. So something that's really interesting is that you've seen a lot of graphs, including the last one in China, showing that residential energy is the largest source of black carbon emissions. Depending on what database you look at, it might be 30% or 50% globally. But it's a huge chunk of our global emissions. If we're not going to figure out how to mitigate black carbon from residential energy, especially in these areas that are sensitive to climate, or the black carbon emissions, like the cryosphere, it's going to continue to be a big problem. But the focus on mitigating the effects of residential fuel have largely been focused on CO2 equivalent, maybe health, maybe energy purposes, but not really looking specifically at black carbon. So if you look at the carbon sector for offsets, for example, that's all driven pretty much by fuel efficiency, right? So if you're looking at CO2 equivalent, how much fuel are you saving, right? The incentives are all based on that. They're not based on actually cleaning up the combustion, right? The incentives aren't there. So when we look at potential ways to make this a better system, we need to provide monetary incentives or a regulatory framework in which black carbon is actually integrated for household energy. And that doesn't really exist right now, but we're working on some of those things. So one thing that trying to work on right now is providing those incentives through a results-based financing system which incorporates black carbon for cleaner burning fuels and household energy systems, right? So instead of just looking at CO2, for example, now we're looking at black carbon. We've had a method in the past that's looked at that, but the barrier to entry has been really high. Monitoring burdens and metrics that aren't really aligned with the impacts of black carbon. They're just looking at CO2, for example. So the method that we're looking at now tries to address those so that we have incentives for really clean fuels and that energy transition, where if you're trying to specifically invest in black carbon, this is a way you can do it in a way that's quantifiable, reliable, and again, hopefully provides those incentives. So we're not just looking at fuel efficiency, but looking at actually cleaning up combustion and reducing black carbon specifically.
Fantastic. Thank you, Michael. Indeed, it's been always a challenge looking at well, the CO2 equivalent and then actually harnessing the benefits that we see from the short-lived climate pollutants altogether. So not only black carbon, it's not only limited to that. In terms of time and temperature, so if we could go back in time and start all over again, I would love to actually have this as the key metrics, temperature and not CO2 equivalent, but here we go, we're stuck with it, we do with it. But looking forward to how your approach will help us here going forward. Financing is really, really important, and another way of making sure that more money goes into these activities is making sure that we have things reflected in the NDCs. They become our next investment plan in a sense. They're due this year. Well, they were due in February, but they're being prepared and hopefully submitted by everybody at COP at the end of the year. 19 have come out already. The majority of them have a reference to super pollutants, and I think that's really interesting as well. Not necessarily as a concrete target. For some, it's really an economy-wide target, but then there's climate plans and strategies that come along with that, and I think that's really interesting because they give us the specificity to actually track as well how well we do on the super pollutants. With that, as an introduction, I would like to come to Nestor Garzon, Director at the Directorate of Climate Change and Risk Management at the Ministry of Environment and Sustainable Development in Colombia, and you'll talk to us about the take of Colombia with regard to the NDC and the short-lived climate pollutants.
Bueno, muchas gracias. Buena tarde. Primero que todo quiero indicar que. Good afternoon. First of all, I'd like to state that for me it is really surprising in all of the years that we've been working at the Ministry of the Environment is that this space is one of the few where I've been able to participate in health related issues, and I am surprised because we have mentioned I have been part of other panels, and I've been given access to the panels, and I hear these works, but as an independent way, and so I see science is separated from academia, politics or policies, the sectors, the financial, and definitely, I believe that one of the steps that we have to develop, and I may be jumping ahead in terms of conclusions, to be able to integrate all these works and exercises that are being developed. Basically, I want to share with you a text that we elaborated at the Director's Office of Climate Change, and I want this to be very focused, and I want this to be recorded in your agendas. But basically, to tell you that in Colombia, the atmospheric contamination for 2.5 particulate matter caused about 7,800 deaths in 2018 and about 7,300 deaths in 2015. This according to the update study on the economic evaluation of urban air contribution performed by the Planning Department in Colombia, and over 35% of the mortality was related with ischemic heart disease, affecting mainly the cities of Bogota, Cali, Medellín, Cartagena, Cúcuta, Barranquilla, and Bucaramanga. These cities that I mentioned here are important cities in Colombia, and we have found cases ever more reiterative of crisis due to air contamination. In Colombia, we have wanted to make progress also, and in fact, there were meetings with several sectors, even with the National Disaster Recovery Agency, seeking, or which seeks that the contamination of air be defined as a risk scenario, just like floods are, just like landslides are. There are many complications in terms that we don't have the information, and thus what I mentioned, if we don't have the information, we can hardly move forward. If in Colombia we are vulnerable to these events that I mentioned, and we still don't have concrete information, it will be harder in the case of air contamination. But that is not that should not oppose, or that should not prevent us from developing these exercises. I wonder if my colleagues in government entities are taking this into consideration, or would take this into consideration when developing their plans. Something else, at the natural emissions and green gas inventory, black carbon contaminants published last year in the first BTR. The BTR, for those of you who don't know, are the biannual transparency report that you mentioned, which is related to the Paris Accord. And then we started finding connections or associations between the top in the BTR that Colombia published recently. It is a 2-year report, and this was published in 2024, in December of last year. It included elements such as the green gas inventory in every sector. Every sector reports how their green gas emissions are doing. And so we follow up on that based on that report, and we present on the NDC. The NDC, for those of you who don't know, are basically the agreements that Colombia has internationally, commitments in the climate change wise commitments, and Colombia is making progress because the reduction of black carbon reduction is associated as a goal for 2030. So Colombia is working on that. The NDC is, as I said, is commitments that the country has internationally, but which is not only undertaken by a single sector. No, every sector integrates the NDC. Each one of the sectors has goals that they have to meet within the framework of the NDC, and it is a work that should be done in a coordinated and regulated manner, and it shouldn't fall on only one or the other sector. Also, to tell you that to monitor the national advance on the level of emissions, Colombia has established within the frame of BTR the indicator of advance and the reduction of emissions of black carbon, which in 2020 exhibited a reduction of 5%, and in 2024, 0.24, due mainly to the distribution of reduction in the consumption of solid fuels, the reduction of the production of coke, the use of cleaner fuels, and the improvement of vehicle efficiency and the use of more efficient technologies. Basically, the task ahead is great, which is to achieve the emissions of black carbon, which have stayed at a relatively stable level, but we need to reduce that. We will need to regulate on the use of fossil fuels, and that will generate benefits of the rural areas, but that will have a positive impact on the well-being of children and youth, women and senior citizens. To end, I'd like to inform that we are currently updating the NDC, This NDC, as opposed to the previous version, is involving work with the communities, with the grassroots people. So it is taking into account ancestral knowledge. It is taking into account indigenous traditions, the Black Afro communities, Raizal communities, peasants communities. It is an inclusive effort, and as I said in part of my remarks, it is being prepared hand in hand with every sector. Thank you very much.
Thank you very much, and congratulations for the inclusion of a black carbon target into the NDCs. That's fantastic. And also thank you for having made reference to the BTRs. I think that's really important with regard to the tracking, that we actually make good on this. So really good points. I think it's important, and again, a really good example to say that, yes, it's across all the sectors. For some countries, maybe we get to that point. It's highlighting one or the other, but it's really, really good that you were able to already go across all the sectors. And this point about stakeholder engagement is not to be underestimated, because in the end, if it goes to the implementation, we want this to be successful. You need everybody on board. So having everybody on board to build up to the target is actually a really good step. So thank you for having highlighted all of this. And I hope with that mini summary, I've helped those who may have not had time or thought to have translation equipment. Now we go to another region. And we have Pema, and he authorized me to just use his first name. The Director General, International Center for Integrated Mountain Development, ICIMOD. ICIMOD has been a long-term partner of the CCAC as well, has done enormously important work given the black carbon Himalayas relation as well. I think back to work that we've done on the brick kilns, including post the terrible earthquake, and to help rebuild in a different way to reduce the emissions from one key sector. But now, can you tell us about ICIMOD's country support, and also from your regional member countries, what have been the most effective strategies for reducing black carbon emissions?
Thank you very much. Now, ICIMOD is working in the Hindu Kush Himalaya. The HKH stands for Hindu Kush Himalaya, and nowadays we often refer to it as the third pole. Now, why is black carbon important? The reduction of black carbon important for the Hindu Kush Himalayas. It is the largest reserve of frozen water that provides livelihood, supports the livelihoods of close to 1/4 of the world's population. Close to 2 billion people if you take into account all the people living in the mountains and those living downstream in the river basins. So black carbon in particular is responsible for around 29% of the glacial melt. Now, glaciers in the Hindu Kush Himalayas are melting very, very fast. I think faster than anywhere else, maybe compared to the two poles, maybe not as fast as there, but I think if you compare to other mountain areas or other regions, then the black carbon impact is also accelerating that melt. Now, through the support that we have received from FCDO, UK, under the CARA program, we have a project called HIREAP. The HI stands for Himalaya REAP, Resilient Enabling Adaptation Program. We have been trying to address this, black carbon emissions and reduce. Now, looking at the sources, we find that residential emission of black carbon is something that we need to address. And we have been also working with Clean Cooking Alliance and the other partners to see how we can replace biofuels, how we can replace fuel wood. And if you look at the high Himalayas, people still use yak dungs, dried yak dungs for cooking. So I come from Bhutan, and actually I grew up in a family where we used to do that. And at the end of the, when you wake up in the morning, our face used to be covered with soot, and in the morning, we could hardly breathe. So that was the situation. So respiratory diseases, lung disease, very, very common. Even now, this is practiced. So, how important this indoor cooking and heating, challenges are, and how we have to address that. Second, I think the transport sector, again, there our role is more in assessment. If you look at it, the emissions of black carbon and the dust particles from the transport sectors is very, very high, and that is still very much an issue that we need to deal with, and ICIMOD is providing the evidence and the data for the governments to act in terms of greening the transport sector and moving to more cleaner energy. Now we have also a project on looking at how we can convert crop residues to bricks, pellets, so that they can replace the coal for fueling industries like the brick kilns and so on. Now this is a program that is underway in India, and we are trying to do that across also in other countries and so on. Brick kiln was a success story. We did that in Nepal, basically converting the firing system from the conventional straight firing system to adopting a technology called zigzag. And so we managed to convert a lot of brick kilns to adopt that technology, and that has also spread in Pakistan. So earlier we have heard the Secretary of the Punjab government talking about the brick kilns in Punjab. They have came out with a degree requiring all the brick factories to convert to adapt to this zigzag technology. Now I am not quite following the thing. I'm just answering your question and so on. So it may not quite follow that one. Okay, so that is the work on the brick kilns has reduced. Actually, if you look at the emissions, it has reduced black carbon emissions by 60%. So the potential of reducing, with this kind of targeted actions, the potential is there. There's so much that we can already do. So a lot of times we are saying lack of innovations, lack of technologies, but we don't act on the solutions that we already have at hand. So these are the things that we are doing now. If you look at around the region in Nepal, there is a very strong focus on using electric vehicles. There's been a lot of import of electric vehicles from both China and India, and I think the number of electric vehicles in recent years have actually increased so much that every second or third car that you see in Kathmandu is an electric vehicle and so on. Look at India, the solar energy, the program is taken in a big way, and I think those are very sort of encouraging developments that we see. In Bhutan, while we say that we have no air pollution, we do have. And resident air pollution, the indoor pollution, is very high. So I think this is something that we need to be aware of. While we have around 60 to 70% of the area under forest cover, there's no reason for complacency. And we need to see how we can, address, also adopt these technologies like electric vehicles, public transport, and so on. So around the region, we are trying to also learn from the good experiences in terms of policies and practices. In particular from China. China has managed to take, reduce the pollution substantially, including black carbon, as we have heard from Professor Xu. So these are things that ICIMOD is doing, and we are trying to bring together the member countries to learn from each other and share this good practice. Thank you.
Thank you. And we now have 5 minutes left. So I would like to ask to each of you, something about a next step, and maybe for Elisa, rather back to the study. What is a good example? So everybody has 1 minute.
Thank you. So to me, the good example is that prioritizing using the black carbon as a lens for air quality management practices. So far, these practices are focused only on PM2.5 and PM10. Instead, if we use black carbon as a lens, then we will unlock further benefits, because the reductions on PM2.5, it does not result in equivalent reductions on black carbon in all cases.
but the other way around would unlock that opportunity. Thank you.
Okay, fantastic. Thank you. Professor Xu.
I think for the black carbon, it's another, like the PM2.5, it's a matrix because black carbon came from different source, may have different toxic potential. And during the air, it can be aged at a different time, so it has also different health impact. So actually, we use the night absorption to indicate it as well, but its chemical content could be very different. So now we are simplifying the way of scientists funding and the delivery message for the policy to make sure that we can use black carbon as an indicator for the major air pollutant. But it may not necessarily solve all the problem. And into the future, I think that the only way to get rid of black carbon is use clean energy. And that's, I think, we should work on this.
Thank you. We have Michael. I go in the same order.
Sounds good. Yeah, so I guess something that I'm excited about is to see how we can use black carbon in carbon markets under the Paris Agreement. Especially, I'm glad you mentioned the NDCs, because countries like Colombia, Nigeria, that are leaders in this respect, setting black carbon targets in their NDCs, I think that will give them a real advantage when they are implementing Article 6 programs, where they're looking for buyer countries to help support them and have programs that are mitigating climate pollution in general. If they have strong BC programs where they're trying to meet their NDCs, I think that will give them a real advantage in those markets. They'll have a higher value for their carbon. And I think that's, again, those financial incentives I think are really critical, right? We need financial incentives to bring down BC, and this is one way that we can do it.
Thank you. I go to Nestor.
Gracias. Thank you. I will keep the initial message, or maintain my position in the initial message. I personally think that we should develop the integration of elements and the integration of agendas. I insist a lot on the joint sectorial work, and proof of that is an exercise that we have been undertaking, carrying out in Colombia, which might seem small, but which have yielded important results, which is the replacement of wood stoves with eco-efficient stoves. We have found lots of significant improvements in terms of health, in terms of quality of life, which I believe that we must also take into account. I mean, how the improvement in actions vis-a-vis the black carbon improve the quality of life. And also the message is directed toward the development. Colombia is one of the most ambitious countries in terms of the NDC commitment, and surely with a work that we are currently engaged in to update this NDC, which I would mention is being prepared with all of the social actors, out will come many measures that should be implemented. That is, I think that we have to move from study to action. And so that is the message.
Thank you very much. And it's all about taking the actions indeed. And now to Pema. Yeah, please.
Thank you very much. I think from our side, we are looking at an approach linking science to policy and practice. So really defining or identifying the specific sectors where we could make a difference. Now we look at the brick sector. We have addressed that to some extent, and now it's up to the governments to scale up, or other development partners for the scaling up. We have done the demonstration linking science, and also, try to advocate for policies, appropriate policies to adopt that. Now, if you look at the use of alternative energy, renewable energy, I think it has to be linked to the kind of use that it will benefit the target groups. Now we are looking at productive use of alternative energy for irrigation. Now in most of part of the Himalayas, water sources are drying up. So we have to lift water from lower grounds to upper areas for irrigation. So we use clean energy instead of using diesel motors for lifting water. Now we have to convert to solar pumps to lift water. So linking, clean energy to productive use for agriculture, for tourism, for food processing and packaging, I think that's the way to go. And as far as the transport sector is concerned, it is for the bigger players to come in by, transforming the individual cars, the fossil fuel powered cars into public transport, mass transport. I think countries like Nepal, Bhutan has abundant renewable energy, electricity. So we have to see how we can use that for promoting public transportation system. So that is, I think, the solution towards a greener way. Yeah, thank you.
Thank you very much. Please join me in giving a hand to our fantastic panel. Stay with us if you can, please. The few minutes that we hand over back to Rachel to give us some concluding remarks, and I hand over to you so that we have a smooth transition.
Thanks, Martina. I don't know how I'm going to summarize all of the fantastic information that we've had from the panelists, so forgive me while I sort of do my best. I think for me, the first thing that really struck me in terms of sort of ultrafine particulates is the gap in the exposure response, and that we can't have the air quality guidelines until we have that, and the importance of monitoring. We've heard that a lot over this conference and in all of the sessions, but there's a really nice concrete example. In terms of black carbon, all the myriad examples of the evidence showing how it's impacting our health, I think I was really struck by that, and particularly the difference in the primary and secondary formation and what that's kind of doing to us. I think one of the common messages we heard several times from the panel and speakers was we need to look at this all together. And particularly, I think, Martina, you were very powerful in terms of talking about how we need to think about climate and health. If we just have a one-dimensional view, we're going to have imperfect solutions and we're going to have trade-offs that we just don't need to have. So I think that's really important in keeping those together. There's such shared sources. The climate drivers are also the sources of the air pollution that we've been talking about. We also, in terms of the theme of looking at it together, we heard how working over here in science and over here in politics is really unhelpful. So how can we bring those worlds closer together? And we also heard about the need for incentives to be integrated. We need to give people the right incentives. Mostly people would like to do the right thing. We just need to help them. So that was one of the themes that I thought came across really clearly. I was really glad to hear the just transition referenced and the need to think about equity in these solutions. We've heard about the vulnerable people who are impacted by black carbon, by ultrafine particles. So thinking about who's being impacted and who's benefiting from the solutions is as always, really, really critical. The last thing I wanted to pull out as a theme, and I hope you all heard it loud and clear as well, was the evidence. We need more, sure, and we're all in the business of evidence generation and science, or a lot of us here are, and we will continue to work on those evidence gaps. That's absolutely what we're all about, but there is enough evidence already to act. And the other thing we've heard is that there are available, feasible solutions. Let's be focused on the big sources and on the big opportunities. And I think I'm quoting you, Pema. I think you said, act on the solutions that we have at hand. And I think those are some really nice words to finish on. We've got that triple win we're going for. We've been reminded starkly today what we're fighting for. If you're not convinced by climate, if you're not convinced by clean air, then hopefully you are convinced by health. We've heard the impact on children. We've heard the impact on the elderly. We've heard the fact that it is getting into our brains. So really, I think we're reminded a lot by coming together at conferences like these, just exactly what we're fighting for. And we can see from the experiences and the examples we've heard how possible it is. So I think I'll leave on that note, and the acting on the solutions we have at hand. And just another massive round of applause for our speakers and our panel. Thank you.
And I just got a note that